Today I have with me Todd Wagner, who is the Vice President of Financial Management and Business Development for our company, and Ed Valiant, he's the Vice President of Operations. And I'm Lisa Defabon, and we'd like to thank you guys for the opportunity. Thank you for the opportunity to do the study, and we also wanted to thank Ed and his team at the building for their assistance and cooperation and providing much of the information that we needed to complete the study. So to start, for those of you that aren't familiar, we have 25 years of experience with nursing homes and county nursing homes in particular, and I think that was part of the selection process for completing the study. As part of the study, we were provided information from the employees that you all had collected, and we did take those into consideration. We also had a team of nursing home professionals that went in and met with Ed and his team and went through every department in the facility to complete the study.
Okay. Part of this, the starting point of any assessment, kind of create a baseline of the results of operations so you can understand any adjustments from that. And this schedule here shows the historical trend of county support, county contributions to fund the operating deficits at Cedar Haven. And you can see since 2003 they have required county contributions increasing over the years. In 2012 it was a little over $3,061,000. For 2013 I have a projected number of about $4,365,000, and I'll go in a minute or two I'll go over how I arrived at that number. But collectively over the years there's about a $20 million deficit that was funded by the county contributions. The next slide really shows the performance in 2012. When we went out there, the November 2013 financial statements were the financial statements that were available. So we looked at the November 30th, 2013, and then did a projection annualizing those results. You can see that in 2012 the net loss was, and net income was a loss of about $3,061,000. Through November 30th it was about a little under $4 million. For the November 30th numbers, a couple adjustments that I made, since the county only records pension expense and depreciation expense and certain other items only at year end as part of the year end accrual. I made some adjustments to adjust those November financial statements that were provided based on estimates provided to me by the finance director at Cedar Haven. So they do include an estimate for the pension expense.
So that is included in your presentation today?
Yes.
That was my biggest question. I wanted to have clarified very simply yes or no, and the answer is yes.
Yes.
Thank you.
May I clarify that? It only addresses the pension arc going forward?
It includes, the 2013 number includes an estimate of approximately $1.755,000, which was provided me by Cedar Haven. So that shows, what we basically did was took a look at this 2013 numbers and used that as the baseline.
So it's for 2013?
2013.
It has nothing to do with the underfunding of the pension at this point in time?
Correct.
Okay.
And you can see that the census in 2012 was about 307, and in 2013 it averaged about 300 census days. So on the previous slide we showed the increasing county contributions. That's really a factor of several items. One, the declining, a little bit of declining census, and also escalating health insurance and pension costs also contribute to those losses. So for the year, based on analyzing the November financial statements with those adjustments on pension and depreciation, we projected a loss of $4,365,000.
Again, I have to commend Ed and his staff on being extremely helpful, and actually many of the frontline staff offering suggestions that they had come up with as well. Looking at the revenue side, and then we'll look at the expense side here in a moment, we identified revenue opportunities estimated at $1.6 million. And we did that through a few areas. The first is to create an admissions department using 2 currently budgeted staff in the building, refocusing them on census development, marketing, a short-term rehabilitation, and an expedited admission process. We identified that there's definitely some room to move there as far as expediting how admissions are processed. And although the census has been historically high, your mix of short-term clients, your Medicare, Medicare HMO, and other insurances has not been very high. And we'll go through that in a moment. By maximizing that, you also increase your revenue. Also looking to adjust the resident room rates by $5 per day for an annual increase, total increase to the facility, $39,500. Historically, they've been increased on July 1st of each year, between $5 and $10. Looking to increase the Medicare and Medicare managed care census by 10 residents per day. The revenue increase is approximately $1.4 million, $389,000, or the net earnings from that are approximately $850,000 because there's additional expenses that come with that, such as physical therapy, occupational therapy, pharmacy, and other things that are all inclusive in that Medicare and Medicare HMO rate. We actually believe that the 10 residents is a valid number. We went and looked back historically. 2012, the building averaged just over 207, so we definitely believe there's room to move there. Increasing the Medicare rug distribution and capture the information to increase revenue by approximately $166,000, and again with a net revenue of $150,000. Again, there's some expenses that come with that. And what we mean by that is looking at each of the individual residents that are there on short-term rehab, making sure that the facility documentation system is capturing every piece of the care that's being provided to them. And in doing so, it changes where they fall into the federal rug distribution for Medicare payment. So even though the staff's providing the care, if all of that's not captured appropriately, and in many instances it's based on the type of computer program or documentation systems the facility has, you can capture another $150,000 a year in revenue, taking care of the same clients that are there now. Looking at all options, we also looked at the dietary programs and determined that by offering a guest meal program and an employee meal program, by offering those meal services to the staff and to visitors and families for a nominal cost, you'd have a net increase of about $36,814 in revenue for that. In talking about the short-term rehab, we wanted to just quickly explain a little bit about where Cedar Haven falls with the other facilities here in the county. And on page 7, we have a chart that shows the 2012, which was the most recent statistics we could pull, Department of Health utilization data. And if you go down through, you can see the percentages of short-term rehabilitation clients.
I think
Looking at that chart, you'll see that Cedar Haven has approximately a 5% mix for short-term stay and a high occupancy at 96%. They admitted in 2012 in the 324 bed census, 145 admissions, 35 discharges. When you look at the competition, for example, Cornwall Manor with 108 licensed beds actually admitted 105 individuals and discharged 62. Manor Care with 169 beds admitted 433 residents and discharged 349. So there's definitely a market out there in the county for short-term rehabilitation. At this point, the facility's just not getting enough of a share of it. And we put examples in the full report as to how that can be increased. Any questions on that before we move on?
I just had a question about another short-term Medicare reimbursed opportunity, and I didn't see it in the report. Is there any money stream available if there be a need for for example, an inpatient? What's the term for? I know the VA hospital has a hospice unit, for example. Are there any advantages to converting some of Cedar Haven to something that would accommodate a hospice unit inpatient that would be a new revenue stream? Is that, is not possible? Or
Under your current facility license, your beds would simply continue to be licensed under skilled nursing, and there is not a hospice payment for that.
Okay.
In order for hospice to provide that service in your facility in a resident room, the resident must agree to waive their Medicare benefit for the nursing home in order for hospice to pick up the Medicare piece to provide those additional services. In order for it to be billed directly to Medicare as a hospice, the unit itself would have to be licensed by an outside purveyor as a hospice, and you would basically become a landlord for that unit.
Okay. Thank you.
We looked at expense reduction opportunities, and as we know, it's always difficult when you're trying to look at ways to reduce expenditures, especially in a service area such as a nursing facility where it's so service customer focused. But we did identify several staffing changes in several different departments that could reduce the overall staff, which we believe would not impact resident care and services. They were based on current industry staffing practices in other facilities of the size. Savings including benefits of $798,000, the benefit piece being the health, pension, taxes, workers' comp, and the other benefit package piece of it. In activities, we identified that through readjustment of activity scheduling and staffing, 5.6 positions, or approximately $141,000. In admissions, we strongly recommend actually developing a full-blown admissions department, but again, taking 2 positions that are currently in the building, reassigning them, providing additional training and education, and that way there would not be an economic change. In dietary, even though at the current time it's been outsourced, we do believe there's still the ability to readjust staffing there by 2 positions for an additional savings of approximately $48,000. In housekeeping, by readjusting staffing, looking at some of the newer practices that are out there, we believe there's actually 9 positions, or approximately $215,000. In laundry, again, looking at some different protocols, we believe that could be readjusted by 4 positions, or approximate savings of $95,000. And in maintenance, again, looking at some different readjustments of staff, 4 positions, or $96,000. In nursing administration, spent quite a bit of time looking through how the administration set up some of the duties and tasks that are being done. We believe we can readjust the nursing administration staff, including the positions that are stated here, for a total of $486,000. Looking at nursing direct care, we do believe there is some room to move there. The current facility is running at a 3.6 PPD, or per patient day, nursing hours. We believe that through some minor adjustments on the staffing pattern, they should be able to function fine at a 3.3 and still provide good quality care. And most of that we believe can be done through overtime reduction and reduction in agency usage, looking at some weekend programs and some other things to assist the staff that way.
Do you recommend giving the union a copy of this to allow them to talk with the employees to, see the readjustments and things, and if it's something they can live with? I'm thinking, if somebody's buying it, they're obviously going to do this, and so would they be agreeable to working with the commissioners?
Well, obviously, all of the recommendations we're making, the commissioners would decide to work through this program. You need to work very closely with your staff, very closely with the union, very closely with the residents and the families,
Yes.
so that everyone understands completely what's going to happen, has an opportunity to voice their concerns, provide some additional feedback, because it will be a concerted effort to make it happen.
Okay.
But it has happened many times, and the best practice is to make sure that everyone's aware of things up front.
So the answer is yes, share it with them.
Yes.
Okay, thank you.
Sure. The next we looked at was the health insurance, and this is always an issue that everyone's very concerned about. However, looking at Cedar Haven and their employees, they're one of the few, even county nursing homes that we identified that employees' coverage is still provided 100% for employee and family. We ran the scenario on 2 different percentages of wages, one looking at 16% of wages as your health insurance expense, and the other as a 20% of wages. The result savings is between $1.3 and $2.2 million. For the numbers that we put together for your performance today, we actually kind of split it and went with 1.19 million. We looked at purchasing, and the county has had some very good long-standing relationships with a lot of vendors, and they do try to purchase locally wherever they can, but they also have some of the larger national vendors. We did, however, identify that through a competitive bidding process, through joining one of the larger group purchasing organizations, and going through some of the contract reviews, there's definitely some savings to be had there.
I did have a question on this particular section. I don't understand how we're not getting the best price because CCAP, NACO, they all have already pre-bid. Are you saying that people are coming in under those pre-bid prices?
The state contract doesn't cover everything.
So they don't cover those like depends and things like that?
There's a lot of things that are not covered.
So that's not covered?
It depends on which ones. There's some of those are covered under state contract, but they're covered at qualities that many of the nursing facilities don't want to use.
Okay.
And, you know, they work very diligently to try and change those. CCAP has worked very hard on that. But if we go to the next slide, I can just give you two examples. When we looked at incontinence supplies and compared what the facility is currently being charged for the same supply through one of the GPOs that we have facilities that are utilizing, it's $129,000 a year savings.
Yeah, that was just amazing to me, and that's why I thought, where's the state contract price on that? I don't understand. Yeah.
State contract isn't always the cheapest, and it's not always the most cost-effective product.
Okay. So
Because sometimes, I'll give you another example, in wound care, you may have an item on the state contract which is less expensive than another item, but you have to change that item every day. Or the other item in a wound product might be changed once a week, which is better for the resident. It's less trauma to be taken off and on all the time, has less opportunity for infections. So in the long run, it's actually less expensive to utilize the more expensive one once a week than the less expensive one every day.
Okay.
In dietary supplements, we looked at a couple of things there, and we believe that through some work with the dietitians and the residents, we can do more with fortified foods, more with pleasure foods that the residents would enjoy, a chocolate milk rather than a milkshake, those types of things, as well as there are some very good generic brands of crackers, cookies, and those things. It's very fortunate the facility is able to use the name brands, but it's $40,000 a year savings just looking at those two items. We talked about the expense reductions, but we also talked about the opportunity to add 10 additional census on the Medicare and Medicare HMO side. That also adds expenses, so we wanted to show that to you as well. So by adding those additional 10 census and the higher rug categories that go with that, which include higher therapy, higher pharmacy, higher lab and x-ray, that adds about $557,000 annually to the expense line. In addition to that, we truly believe, we know that the building's the gem of your county. The people of the county know that it's here. They just don't know all the great products and services that they can get there. And we really believe with a true admissions team and a dedicated marketing budget, and I know that number seems high at $60,000, that's actually a very fair, reasonable number for a building this size and a market this size. We truly believe with that, it would allow you to get the numbers you need on your census.
And I noticed you mentioned about updating our website and things, so it would still be part of the county website because we have one platform. You wouldn't be going somewhere else to do that. That's not your recommendation. Just updating what we have?
It depends. In some counties, their format won't allow the most recent updates. We've worked with counties that their current websites are actually mobile platforms where you can download things on your smartphone, your iPad,
Yes. Yeah.
and to the point where individuals can go through that portal to actually start an inquiry to let someone know that they want additional information, have someone follow up with a phone call. So it really depends on what your county's capabilities are.
Well, CCAP hosts our website, and I know that they do apps when we go to the conferences, so it would seem to me they have that capacity.
Again, it just depends on what grade your current website's at and when it's been updated. Many of the websites, as you know, are updated every year now or every 6 months because the technology just keeps changing so quickly. But it's making your website very user-friendly, providing the information that they need. You know, most individuals today don't use the phone book anymore. They go to your website to see the information, and most of your consumers today are very educated. They want to know all of their homework before they come and meet with you.
Yes.
So the more you can have your website make that transition easy for them, the more likely they are to come meet with you.
I can't argue with that. I agree.
It's very interesting that the group prior to us talked about Berksheim because we actually are going to talk about them as well. We had permission from Commissioner Christian Lineback to share this with you today. Berksheim was having similar issues as Cedar Haven, and brought our firm in as a management contractor actually in November of 2010. And we just wanted to show from this chart that by looking at some of the expense reductions, looking at some of the revenue enhancements, 2011 they went from 750,000 net income in 2010 to 2.6 million in 2011, just under 2 million in 2012, and a projected 2013 of approximately 1.6. They had many of the same issues that you have as far as their census was very high. They were running at 99% occupancy, but their mix of residents weren't. We worked very hard with them to ensure that they were still admitting individuals directly to the facility that were Medicaid eligible, but they were also allowing for many of their constituents in the county to come in on that short-term cycle as well. So this just gives you an example of a facility that very similar. They were 420 bed size, and they were able to do a turnaround.
And the folks that were in here earlier alluded to the fact that you're projecting out, and I assume you're involved with that, and things don't look that rosy in the future. Is that correct?
We worked very closely with the county, and the county had asked us to do a projection with them. They do project out every 5 years, and it's a rolling 5-year projection. So each year we work with them to look at what the trends are as far as reimbursement, as well as what their expenditures are. At this point in year 5, they would go to a negative. However, there are still additional opportunities that they have that they can look at moving forward. It will be their decision at that point, just what they want to do or not do. Actually, have been bought into this concept where they are now working with us, and we're actually designating one unit of the facility into a true short-term, high-acuity Medicare unit, which will be where residents will come for 20 to 30 days short-term rehab and discharge, or higher acuities, IVs, wound vacs, pumps, those types of things, because it has worked for them.
May I ask one other question?
Certainly.
Where was Berks County at the time you took over in relationship to where we are now?
Very similar. Their difference is they have a new building, but very similar. They did not have a dedicated admissions program. They had areas of staffing where readjustments could be made. They worked with their union to make some changes to their benefit package. And
Financially, at that point, where were they?
They had a net income of about $750,000.
So they were still in the positive.
They were, but they were projected to go into the negative the next year.
And they also, because I've spoken to Christian about this, if I'm not mistaken, they have their pension fully funded.
They do it this time.
Just summarizing the revenue enhancements and expense adjustments that Ed had reviewed, we project that there's a potential increase of revenue of about $1,628,000. That's primarily from the increase in the census, primarily Medicaid, Medicare, HMO. We assume that the average Medicare rate about $415. So it's a combination of increase in the rate for your current residents that are Medicare in the facility right now, and then the additional 10. And we assume that of the 10, 7 would be traditional Medicare residents, and 7 would be Medicare HMOs at a lower rate of about $300 a day. That combined with some of the revenues from the dietary programs and a couple other things generated $1,628,000 in revenues. From the operating expense standpoint, we had recommended there's a reduction in the expenses of about $2.9 million. That's a combination of actual reduction in expenses, and then we also recommended some increases corresponding to the higher census. Of that, approximately $2.3 million of the operating expense reductions are from the staffing adjustments, including benefits, including health insurance at the, and then also included in that was a adjustment in health insurance for about $450,000 for those reduced staff positions, and then another $1.2 million from reduced offering a different type, potentially a different type of plan, either from changes in the plan, define the components of the plan, whether it's higher co-pays, higher doctor visits and things like that, the plan design, also increase employee contributions. Combination of those factors would result in those savings.
What we're proposing in here, none of these are outsourcing positions in the building.
Oh, okay.
Everything that we've proposed in here so far is working with your current staff, looking at open positions, looking at reductions in some areas of positions.
But not getting rid of anybody, it's just moving
Well,
people around?
No, there will be, if you implement it fully, there will be positions that will become vacant.
35, is that correct?
But there's a total of 53 positions.
Oh, okay. I missed some.
Some are vacant, some are not. And some can be moved into other slots where you currently have openings. But we did not put in here where you would actually contract with another company
Okay.
to take on those individual frontline staff positions.
We did identify in the report there could be potential additional savings over what we're including in our report if you did outsource certain functions.
And those are the things you're talking about with Berks County perhaps then?
Berks County did not do any additional outsourcing. They had previously outsourced their management of their laundry and their dietary departments and some environmental management positions, but they did not outsource their other departments. These
Okay.
were actual working with the staff, working with the building to refine processes, implement computer programs to expedite some areas.
Is the cost of the computer programs in your projections?
It is not, because we understand that that's already being processed, that Point Click Care is in the process of being
Okay, so this
installed.
would be the CCAP grant? Is that the one?
Right,
Right.
well, we're doing very minimal at this point.
Yeah.
Right.
We're not
So
going to
the-
be going into medical records or anything.
Right, so there would be some additional cost to that down the road when that is
Okay.
fully in. We did include in here additional cost in the dietary area for a dietary tray ticket system, which will expedite that.
Combination of the staffing reductions along with the benefits, the change in the health insurance, and then that combined with some of the increased costs that we had included for increased therapy, pharmacy, x-ray, and then we also looked dietary raw food costs for those additional residents, utilities, and then other costs. We project a net reduction of expenses of $2.9 million, which combined with the revenue increases would have a favorable impact of about $4.5 million compared to where you're projected in 2013. And that would, including depreciation expense, would leave a projected net income of about $177,000 based on 2013 results, projected results.
Yeah, I think another good example, you asked the question about how far behind Berks was before we started, and Bradford County Manor probably more closely resembles your situation in respect to the losses that they were experiencing before and the revenue that they have now.
And also in our evaluation and our numbers, we included $1,000 per bed for capital expenditures for the building. Understanding that there is a need not only for routine maintenance, but there are some upgrades that the building, obviously due to its financial situation, some of the non-critical deferred maintenance is deferred.
I think with it generating the EBITDA up there, which is earnings before interest, taxes, depreciation, and amortization, as mentioned in the previous group, it's about $622,000 per year. That would provide the cash flow to be able to fund the $1,000 per bed, or approximately $324,000 per year, and still have positive cash flow. And that also includes covering the county indirect costs being allocated. That's included in operating expenses.
I know it certainly wasn't part of your study, but based on the fact that you've projected out for Berks and indicate that they're going to have significant trouble down the road, but other adjustments, have you taken into consideration how those future changes might affect this if we would implement it?
We didn't study out that far. We actually were looking to see where you're at today and, you know, what type of turnaround can be done. There are additional opportunities, obviously, with any facility, and the more that you implement, the more you're able to look and see what's there. And again, as the previous group said, we don't have that crystal ball as to where the state funding is going to be on that side of it. A lot of it depends on where the state goes with their funding, where the federal government goes with their funding. But you have a good dedicated staff there that really want to make this work. And I think, you know, with everyone rolling up their sleeves and trying, there's still opportunities there.
And may I ask if there's any recommendation or consideration that you made for the fourth floor where those like 40 beds were closed down years back? Is that going to be utilized, or will it remain as storage?
We actually evaluated that section. When that was decertified, it was completely decertified by Department of Health, Department of Public Welfare from your license. It does not meet the current licensure standard for nursing home because the hallways are too narrow, the way the rooms are set up. So we do not believe that that can be reopened
Really?
as a skilled nursing facility.
See, I was thinking, because I hear private companies say, well, you have too many 4-bedroom, and maybe we should have 2 bedrooms, so I thought maybe that would be opened as 2-bedroom and get everybody into 2 bedrooms.
It was one of the first things we looked at when we were there.
Yeah.
But you also have to look at your staffing patterns.
Mhm.
Sometimes spreading out further,
More staff.
it requires you to have more staff so that your staff can get to places. You know, it's 4-bed units are always a challenge in a building. However, we manage several buildings with 4-bed units that run 98, 99% occupancy.
Okay.
It's the quality of the care, it's the marketing, it's the services, it's the upgrades. It may be a 4-bed room, but as long as the furniture's in nice repair, you know, it's updated with linens and curtains and those types of things, residents will still come.
Okay. Thank you. Commissioner Phillips, did you have any questions at this point?
No, I thought it was a very thorough analysis. Thank you.
Okay. Commissioner Ames?
Yeah, I have another question. We're looking at, if I understood you correctly, 4.5 million in increased revenues and cutting of expenses, those two combined.
Correct.
And we're talking really about year 13, which is past, but projecting that out as a savings in 14, is that correct?
Correct. And that 4.5 is if everything's fully implemented.
Well,
There'll be a phase-in of that, so you probably would not be able to realize that full extent of the savings.
You're reading my mind.
Yeah.
It's very nice to throw that 4.5 million number out there, knowing that right now we're in the middle of February, and that at best case scenario, union cooperation, people are just going to say, yeah, cut my benefits, I'm going to pay 20% of the premium, all those things in place. Best case scenario, when could this happen?
Some of the things can be implemented right away, but to have everything in place and working the way it's supposed to, you're looking at 9 months, 6 to 9 months.
Okay, so the end of the year. So by the end of the year, we're talking about a year and speculating of saving 4.5 million in 2014, but we're going to be through 2014 before we really realize
The
full
full
extent.
extent, yes.
Correct.
Exactly.
That is correct.
So that means it will be another year paying $15,000 a day towards the operation and I think you guys done a wonderful job here. And if this was a private enterprise, a business that I owned, I would institute these things immediately.
Ed, is this something that you would need help with, or something that you think you can take this and run with it? If everybody was on board, yeah,
If ever, no, I would need help.
you would need help with it. So, then that's what I thought, but the next question would be, what would it cost us to have you help us implement this?
Typically, a management agreement based on a percentage of revenue. We would probably, historically, we tend to charge a fee of about 1.5% of revenue, which would probably be about $400,000 per year.
And is that number anywhere reflected?
No,
in
that
the
is not
report?
reflected in there.
And would that be prorated since a part of the year is gone?
Yes. Yeah, it would be a monthly fee of 400,000 divided by 12, whatever that.
And then once we got to the point where everything is implemented, then, and I know you're gonna work yourself out of a job, but we wouldn't need you anymore, cause then staff could handle it? Is that how it's supposed to work?
I think what, the benefit of the management services is, as we talked about with Berksheim, if they do exactly what they're doing today, 5 years from now, they might start to see some losses. So the idea of having a management company is that they are helping you not just get to where you need to be, but continue to grow and change with the market. So with the changes in the market. So hopefully, you know, the idea is to continue to grow and change so that you don't end up in that situation where you're behind in the market area, that you're always growing and changing and adding new services to offer to your community.
Okay. And do you have any advice for paying back past amounts in the pension plan? I mean, we have $1.5 million this year in the budget. I was hoping we would be able to take that and apply that to the pension for past years. I don't know if you're seeing that as mathematically not possible, but...
Again, we're not financial planners. We
Yeah.
really don't focus on that piece of it. So we
Okay.
wouldn't be able to give you recommendations on that.
Okay, all right, well, that's fair enough. I just thought I would ask in case you had experience with it.
The reduction of staff that we're proposing would stop the growth of that liability, or at least pertaining to those positions.
Yes, understood.
To follow up now on our question about the management, you folks helping facilitate that at a cost of about $400,000 a year. My math tells me that if we deduct that from the savings and the increased revenues, we're actually back in the negative. Is that correct?
On the net income, the net income would be $177,000. That would put you into the negative from that standpoint. From the cash flow standpoint, right now you're projecting positive cash flow about $622,000 because its depreciation is really not a cash.
But you may be able to find a few more things to cover that 200,000 shortfall.
We use very conservative numbers. Again, you're at 5% of that short-term mix in the market. And as you saw in the chart, the competitors are all much higher than that. And so we use conservative numbers on everything because we wanted to make sure that they were easily achievable in year one. And so the goal is always in year two to take it to the next level. So I was speaking just from the
For
revenues
the
side.
revenues, yeah.
Right, right.
Understood.
And we truly, we've worked with many counties. We understand these are, not simple discussions, that they're things that really need to be evaluated and looked at.
And we also did not look at all operating supplies and expenses within the facility, so we looked at a handful of things. So if there's other opportunities to take a look at the product that is being used and the price, et cetera, that may result in additional savings.
John?
I want to understand your relationship with Berksheim. You manage it, so you administrate it, but the county, it's still all the county employees that were there and so on. But you as a firm also have taken over and operated entire nursing homes. Am I correct?
The owner of our firm has purchased nursing homes and then contracts with us.
So that's kind of sets up the question I want to ask. If you were to do that as a company, then would you be making the same changes? And do you feel if it was sold to another company like yours, they would be making these same staffing changes essentially to make it a profitable place for them to run?
Was sold to a private sector operator, that it would not be the conservative changes that we see here. The private sector operator would make, very aggressive changes, and again, we were conservative.
Andy?
I'm curious what the goal is from the commissioner's perspective. Is it regard to debt and income of Cedar Haven, or is it okay to have maybe to be subsidizing it at a level of $500,000? I'm curious what the goal is if currently we're at $4.5 million, $3 million in debt.
Would you like to start?
Well, I could speak to that. My goal would be not to subsidize Cedar Haven with taxpayer money. However, we're not looking at true figures by just using this $4 million deficit, because that doesn't really take into consideration the fact that we're probably at this point in time about $12 million underfunded in the pension fund at Cedar Haven as well. So to speculate as to what is it in dollars that we could or should be spending out of our general fund to subsidize Cedar Haven, in order to be realistic about determining that number, we have to throw that $12 million into the mix as well. Plus, the folks that did this study actually have a disclaimer in here saying that they didn't include anything other than I want to be fair, the $1,000 per bed to take care of ongoing, but we have deferred maintenance, and it's been going on over a long period of time with prior boards, heating and cooling, elevator. As they indicated in their report, there are no TVs or telephones in the rooms. So we can talk about a number and what would the county commissioners, or for that matter the taxpayers of Lebanon County, be willing to spend in actual tax money to support it. But I think we have to be realistic and look at what is the total cost that we're looking at here over the short and long term.
Commissioner Phillips, did you care to weigh in on that question?
No, I think Bill covered it very well. I too have the concern about the $12 million pension, which is not included in this, and my concern about maintenance on the building, which is requiring a lot of capital to bring that up to date, as opposed to Burke's being a newer building. So yeah, those are two big issues that are not addressed.
Okay, for me personally, I think that our seniors are worth it, and I think that the marketing that you talk about is sorely needed. The staff down there, the residents and their families, every year hold bazaars and raise money for the things. That's why we have the TVs in the day rooms. I don't know what else to call them. So while they're not in individual rooms, but what's really neat about Cedar Haven, the people don't stay in the room all day and just watch TV. They get out, they're moved like every hour. They tell me that this is so good for them mentally and physically, and it's unique among county nursing homes. And this is what is part of that, what makes Cedar Haven so special. And how that feeling of family is accomplished down there. So even though you look at it as a weakness that they don't have a TV in their room, I see opportunity because they're socializing with each other, with staff, with people walking down the hall. When I go to visit, hi, how are you doing today? And I might not get a response, but at least they know somebody notices them. They're not isolated. And I think that that is so important. But going back to the spring festivals and things, the family, the staff, they hold these things, they raise money to make improvements, to put in new curtains, to put in new tablecloths in the cafeteria. They work together. It's donated by the community. And if we had this marketing that you're talking about, I think that we could raise double, triple, quadruple what is being raised every year down there. And I'm very optimistic that the people of this community would respond because they truly value Cedar Haven, and I'd like to see it continue. And I know these are hard things to look at, but if it's sold, it's going to be even harder. So I think we need to pull ourselves together as a community and make it happen. That's my personal take on this. Andy, I hope I've answered your question.
Can I have one follow-up?
Sure.
On the $12 million, is that the $12 million unfunded pension, is that solely from Cedar Haven?
That portion is, yes. There is a larger amount that we still have to address, But that is the portion on Cedar Haven, yes. Are there any other questions or comments? If not, I want to say thank you very much. I think you did an admirable job of being realistic and not necessarily telling us all good news, but at least telling us a direction we need to go if we want to save Cedar Haven and see it into the future for the community. Thank you.
Thank you.
Thank you.